I'm J.B. Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your not-for-profit community-owned hospital. With Your Health Matters, we're going to be talking about health issues relevant to you and our community, bringing you answers to questions you might have and hopefully helping you live a healthier lifestyle. My guest today is Dr. Christopher Johansson, one of the newest Mayo-trained radiologists that's just joined the KRMC team. We're excited to have him on board, and I hope you'll stay tuned to learn more about what he's doing here in Kingman. We'll be right back after these messages. Welcome back to Your Health Matters. My guest today is Dr. Christopher Johansson. He's a Mayo-trained radiologist that just recently joined us here at KRMC, and we're really excited to have him as part of our team. Welcome to the show, Dr. Johansson.
Thank you so much for having me. I'm very happy to be here.
Oh, great, and we're just really excited to have you and your team here as well. Now, tell us a little bit about yourself and how you came to be a radiologist.
Well, I was born actually in Sioux Falls, South Dakota, and grew up in the upper Midwest.
Okay.
And my father is an obstetrician and gynecologist, so I knew I wanted to be a doctor from a very young age. And of course, anytime you grow up in the upper Midwest, you know the place you eventually want to end up to train is Mayo.
Absolutely.
So I worked very hard, and I actually ended up majoring in Russian and biology in college.
Wow. And
then going to medical school at the University of Minnesota in Minneapolis.
Okay.
And eventually on to Mayo in Rochester to complete my radiology training.
Excellent. Now, you had shared with me earlier that you have also bilingual in Spanish. How did that come to be?
I actually had a lot of patients when I worked in Minneapolis that spoke Spanish only, and we were at a county hospital, so we didn't have a lot of money for translators, and I decided at that point that I absolutely wanted to be able to take care of all my patients and give them the highest level of care I could, and not being able to communicate with them was a huge barrier. So
Sure.
I actually took a year off after medical school and specifically traveled in Central and South America and worked in hospitals there to learn Spanish.
Wow, that's like in the trenches, the best way they say to.
Absolutely.
What do they say? It's not engross, but anyway, where you just embed yourself into the community and learn it the hard way probably. But
it was a wonderful experience, and it really made me appreciate the health care that we have available to us here.
Sure.
And really makes you very thankful for what you have here.
Now, you also spent some time in Spokane.
Yes, so as part of my training I wanted to become specialized, but I also wanted to make sure I understood general medicine so that I could communicate with our general practitioners better. So I did a year of general medical training in a part of Spokane where we were the only doctors. So we were able to do everything and learn about all the different areas of medicine and have some experience there before pursuing more specialized training at Mayo.
So you became a regular doctor first and then became the radiologist, is that right?
I did 1 year of general medicine prior to my
Okay.
medical training in radiology.
Very good. Well, and of course we know Mayo Clinic is known for its collaboration, and we've got an awesome team now of radiologists that are all Mayo trained, and I think you knew each other, right?
We absolutely did. It was for 4 years that we worked together and learned to function together as a team in addition to learning all about radiology. We were on call together running 2,000 beds between the two hospitals that Mayo has in Rochester.
That's a little bigger than Kingman.
Well, it really helped us to learn to function as a team, helped us to learn how to take advantage of each other's strengths in order to get the best care to our patients as possible.
And that's really like at the core of Mayo, is that collaboration and taking each other, building with the strengths and weaknesses so the overall becomes a stronger unit, if
Absolutely.
you would.
It's one of the core principles of Mayo that any doctor, no matter how great they may be, is only one doctor.
Right.
And they can never offer as high level of care as a team of doctors working together to do what's best for their patients.
Well, we're blessed to have you guys here. We're really excited that you've joined us. Speaking of Mayo a little bit more too, you know, they have a program that they've allowed us to share called Medical Edge. That's an educational PSAs that they put out, and I want to watch one right now that talks about education for women with breast cancer. Let's watch it together.
You have a lump, and it could be breast cancer. Those are words no woman wants to hear. After the initial shock comes a ton of questions. What does my diagnosis mean? What types of surgery should I have? What about chemo or radiation? It can be overwhelming. That's why doctors at Mayo Clinic developed a new educational tool. It's designed to help women diagnosed with breast cancer get the information they need to help make their journey a little easier.
It takes a while for it all to sink in.
Earlier this year, Jan Pankratz was diagnosed with stage 1 breast cancer.
There's so much information to process. It's hard to even formulate questions when you're so overwhelmed with a lot of information.
Dr. Sandhya Pruthi uses a new computerized education tool to help Jan sort it all out.
I'm going to show you what the term ductal means.
A visual tool to alleviate fear by helping Jan understand her diagnosis, her treatment options, and what'll happen to her body.
What I wanted to do is to take away that fear of that overwhelming knowledge, start with the basics, and then teach it in a stepwise process.
Dr. Pruthi tested this tool in a study and found that women who used it had a better understanding of their disease and also had less anxiety. The computerized tool combines video and colored images to explain the pathology of the different breast cancers, staging and grade, and surgical, medical, radiation, and reconstructive treatment options.
This is how tamoxifen works.
Those terms that you've never heard before that mean nothing to you, to tie it visually to what was going on inside your body was a huge tool for me to make decisions and feel like I was informed and know what I was actually deciding on.
Providing thorough information to hopefully make the experience of breast cancer a little easier. Dr. Pruthi says this computerized educational tool is not just for patients, it's also for doctors to make sure they communicate and equip breast cancer patients with all the information they need to make informed decisions. Dr. Pruthi hopes to make this tool available to institutions worldwide. For Medical Edge, I'm Vivian Williams.
So I know that we're working on a program here at KRMC with the breast navigation position.
Yes, we're very excited to have funding for this brand new position, a breast navigator. I first encountered a breast navigator when I was doing some additional training in breast imaging at Massachusetts General Hospital out in Boston.
Okay.
And it's so important to have a person who can really stay with the patient from their initial diagnosis from screening mammography all the way through the completion of their care. It's very helpful. They can help to answer questions that the patients have, make sure that they always understand what's going on, what's the next step, what's being done, and why it's being done.
Well, and it probably helps reduce some of the stress and the fear, anxiety
It absolutely
that goes
does.
along with that. And of course, we all know that that can inhibit healing as well if you've got those negative issues going on.
Well, and just having a familiar face there throughout the
Sure.
whole procedure can make it a lot less intimidating. In addition, it can help to make sure that everyone gets the appropriate treatment. We always worry that someone might fall through the cracks, and we always do our best to make sure that doesn't happen. But having someone whose sole position is dedicated to making sure everyone gets the appropriate treatment at the right time and in coordinating the care from all the different specialists that we have available to us here at Kingman Regional is really important, and we're very excited to have them.
That's great. That's great. Now, and speaking of that, we have some new equipment as well here at KRMC that we just, it's kind of a package with you. We got the new equipment and you at the same time. Can you tell us about that?
Absolutely. One of the reasons I wanted to train out at Massachusetts General, in addition to it being a wonderful hospital with a long tradition of very high quality breast imaging and high quality education, is that they've pioneered a new technology called breast tomosynthesis. Traditionally, one of the problems that we've had with mammography is that it can only see the breast in two planes. And if we want to see the breast in another plane, we have to take another image.
Okay.
And so many of the tissues in the breast will be superimposed on these images, and it can be very difficult to tease out, is there anything in this normal breast tissue that we should be concerned about?
Okay.
Things can be hidden by all the breast tissue.
Okay.
Breast tomosynthesis allows us to take 1 millimeter slices through the breast.
That's little.
Absolutely. So we can see really small things that might otherwise perhaps have been obscured on 2D mammography.
So that's really helping with early detection as well. So when they're that small before they become more visible, right?
So that's the goal, is by doing this we hope to be able to detect cancers earlier. This technology was just approved for use in the United States in April of this year. Mass General is already using it for a lot of their screening mammography as well as their diagnostic mammography.
Awesome. That's amazing. And we're one of just a handful, right, of hospitals that have it?
Because this technology is so new, it's not very widespread yet. There's only a few places in the Southwest that have it, and we're very happy to be one of them.
Yeah, we're proud of KRMC. It's one of the advantages of being not-for-profit and being able to invest our monies back into the hospital, into state-of-the-art equipment, that we're able to have that kind of equipment, and then to bring doctors like yourself and Dr. Bodley and all here to help us.
You know, that
with
was definitely one of the things that attracted us to Kingman Regional when we were all looking to start a practice. We all knew that we wanted to practice together, and we wanted to practice in a place that would allow us to be at the same level of quality that we were performing at the Mayo Clinic.
Right.
To do that, we needed a place that would provide us with high quality equipment and would provide us with an environment where we could collaborate, and Kingman did a wonderful job of that.
That's great. Well, I'm excited, and like I said, I'm always proud of KRMC, but then when I hear things like that, it makes me even prouder. So what kind of things, like for a woman, well, we know obviously it's very important for women to have their mammograms done. I think they recommend 30 for the first one, right?
It's actually age 40.
40,
is
okay.
the first, so we recommend that women have annual screening mammography starting at age 40. Now, if a woman feels something, or if her doctor feels something,
or family history maybe, then sooner.
Exactly.
Probably.
So that's one of the ways we'll look earlier with mammography or ultrasound or breast MRI, is if the woman or her doctor feels something. Also, if she has a strong family history. It's very important that women who have a family history of breast cancer talk with their regular doctors. They need to be screened from a genetic point of view and from a history point of view, so that they can get the appropriate radiologic screening.
Okay. And then they just yearly, right? Every year after 40?
So starting at age 40, once a year we like to do a mammogram. That's the interval that we've studied in the United States in which we feel is the best way to detect breast cancer.
Okay, very good. Well, and I know we're going to be having an open house, and don't even know if they've told you about that yet. Part of our October breast cancer awareness, everything's pink that month. It will be like Kingman's had Pepto-Bismol poured all over it. But we're going to be having an open house, I believe on October 20th, where people can come and have a tour of the imaging center and see some of that new equipment that we've got in there, and maybe meet yourself and the other guys in person, so that would be fun.
That's outstanding. I was actually able to fly in from Boston for last year's open house, which was great. I got to meet a lot of the people that we serve here in Kingman, and I look forward to being there this year and getting to meet a lot of the people who come to see us that we get to treat.
And you know, now you're official Kingmanite.
Absolutely. Happy to be here.
That's great. And I think someone was sharing with me that you're a newlywed.
Yes, I just got married 6 weeks ago, immediately prior to moving to Kingman. So my wife, Annette, she's actually also in the breast imaging field. She was a full-time mammography tech in Minneapolis. Hologic, which is a women's imaging company that's done a lot to promote new technologies. We're very happy to have her.
I think we've been working with Hologic too in our marketing, because are they the manufacturer of the tomosynthesis?
So Hologic actually manufactures about 70% of the women's imaging equipment in the United States.
Oh, wow.
They were the main company that actually put in all the research and development to develop tomosynthesis.
Okay.
And so we really appreciate all the work that they've done.
Right, and they've been very helpful in getting us information and about the new equipment and helping us get the word out into the community as well. So,
Excellent.
So I'll look forward to getting to meet Annette as well. And so you're getting settled into Kingman, and then we'll probably have more time to get to know you better. Like I said, at the open house, if people have questions, they can call us at 757-0664. That's my number, and I can give them more information. And we'll have all kinds of things going on in October for breast cancer awareness. So we'll be at the second half of the show. We can talk more about some of those upcoming events and maybe get to know you a little bit better as well.
That'd be wonderful. I look forward to meeting some of the local people from Kingman here. I hope they come on in, and we'll be happy to chat with them about breast screening and other aspects of breast health that they might have questions about.
Super. Okay, well, we'll be right back after these messages. Don't go away.